Maybe you've been diagnosed by a physician as having vestibular migraine. Or maybe you turned to Dr. Google and came across the term vestibular migraine. Now you're on a quest to figure out what exactly you're dealing with and finally get some answers. Hi everyone, welcome to my channel devoted to all things vestibular migraine. My name is Dr. Mushtaghi with otolaryngology, head and neck surgery. And today I want to share with you a clear, concise, and factual video of what vestibular migraine is. So let's say you think you might be experiencing vestibular migraine or have been diagnosed by a physician. What exactly is vestibular migraine and what are its symptoms? In its simplest definition, vestibular migraine is dizziness that's linked to a migraine-related process. First and foremost, the only defining symptom is dizziness, and this occurs more than once and is bothersome. The most common type experienced is actually room-spinning vertigo, which makes it distinct from other forms of dizziness, such as lightheadedness. There are some other people who also have a different kind of dizziness, and we call this disequilibrium. And this is the sensation of feeling unsteady on your feet or feeling off balance. The dizziness that patients experience is often episodic and in variable duration that can last from minutes to days. The episodic nature often occurs because of the migraine trigger. Avoidance of these triggers often leads to improvement in symptoms. However, identifying these triggers is the challenge. The next major symptom patients report are headaches. However, it's critical to know that the presence of a headache is not essential for the diagnosis of vestibular migraine. Now, I know this can get kind of confusing, but many patients who do experience headache note an association with the headache and the dizziness. This can either occur before, during, or after the dizziness attack. Now, the next thing patients often experience are often the symptoms that are identical to those who experience migraine headaches. However, instead of the headache component, they're experiencing the dizziness. These symptoms often occur usually before attacks and include the following. Some complain of seeing zigzag lines, blind spots, or floaters that kind of go across your vision. Others experience a numbness or tingling sensation of your extremities that also spread. Some also report a complaint of nausea or vomiting during these attacks. Also, some people have this odd symptom of sweating, hunger, loss of appetite, runny nose, teary eyes, diarrhea, or even dry mouth. In addition, there's also an odd sensation people report of feeling like their body is either larger or smaller than normal, or other objects that they're seeing also appear larger or smaller than normal as well. We call this an Alice in Wonderland effect. People also describe having severe pain with light touch of the skin. And lastly, people describe some ear symptoms of buzzing or ringing noises, which we call tinnitus, fullness or pressure like you're on an airplane, or fluctuating hearing. Importantly, following these attacks or these symptoms, patients often feel like the after effects of these symptoms, and after they resolve, they complain of things like difficulty with concentration, what we call brain fog, feeling depressed, or sometimes even one-sided neck stiffness that can last up to a few days. So after listening to all these different symptoms, you may be wondering if this is indeed what you've been suffering from all along. The short answer to this is it's complicated. If you feel like you have some of these symptoms that are previously mentioned and they resonate with you, take note of your dizziness attacks and its associated symptoms either before, during, and after. You need to be extremely in tune with your own body and notice everything that's going on despite the misery and the pain that's going on. Understanding these triggers can also be important in understanding your initial attacks. This will be important in identifying what triggers are causing your symptoms. In another video, I'll be discussing all the major triggers and what you can do to prevent the attacks from occurring in the first place. Thank you very much, take care, and be well.